We'll be starting in about 5 minutes from now, but just some practical details, please. Please ensure that your name and the outlet that you are with are seen on your Zoom profile. To ask a question, please raise a hand in the Zoom emojis, and we will come to you as soon as possible. And please make sure that you have your microphone connected. Check the audio ahead of time, or if you have it on your computer so that we can actually hear you. So thanks a lot, folks, and we'll be right with you in about 3 or 4 minutes from now. Thank you. Bye. Good day, everyone. My name is Roy Wadia. Welcome to this press briefing from the UN city in Copenhagen. Thank you for joining us. This week, we have seen significant escalations in the war in Ukraine, and the impacts on health are quite severe. So for that, we have our Regional Director, Dr. Hans Kluge, here on the set with us. We also have from the field in Kyiv, Dr. Jano Habisht, who is our WHO representative there. On the set over here with Hans, we've got Dr. Catherine Smallwood. She's the Senior Emergency Medical Officer. And also joining us online, we've got the head of the emergency division here, Dr. Gerald Robbenschaub. As well, we've got our technical officer on vaccines, Dr. Oleg Benish. So before handing over to Hans, I'll just say one small but pretty important thing. COVID-19 is still with us, and here in the studio, we are not wearing our masks because as I think you can see, we've got strong social distancing in place. So without any further ado, let me hand it over to Dr. Hans Kluge for the opening remarks. Thank you.
Thank you everyone for joining us today. In just 10 days from now, we will mark 8 months of relentless war in Ukraine. But this week, the bombings of Kiev, Dnipro, and other cities nationwide have refocused global attention to the survival of the civilian population of Ukraine and the survival of the health system itself. The escalation of the humanitarian emergency requires an escalation of the humanitarian response. Let me clearly state, WHO is there to stay and support the Ministry of Health under the leadership of Health Minister Dr. Viktor Lashko to stay and support our more than 150 health partners on the ground. The immediate priority is responding urgently to the damage done by the latest attacks on health. With the current total of WHO confirmed attacks on health at 620 since the war began in February. We need to scale up our support to the rebuilding process. In parallel, we have ongoing efforts to boost the capacity and the morale of the exhausted health and care workforce. So far, WHO has helped train about 11,000 healthcare workers on a range of issues including trauma surgery, mass casualties, chemical exposure, epidemiology and laboratory diagnostics. This complements ongoing efforts to bring in life-saving medical supplies, over 1,300 metric tons so far. Supplies such as power generators for healthcare facilities, oxygen, ambulances, surgical kits, medicines to treat non-communicable diseases and vaccines, both for routine immunization and COVID-19. The second priority are the immediate health needs of people in the newly accessible areas back under Ukrainian control. We must find ways to respond to the magnitude of physical and mental suffering endured by these populations. Also for months now, we have been urgently requesting humanitarian access to occupied areas like Mariupol and Donbas, so that WHO and partners can assess needs and provide support. The third priority is anticipating and preparing for the significant challenges that the winter will bring. Too many people in Ukraine are living precariously, moving from location to location, living in substandard structures or without access to heating. This can lead to frostbite, hypothermia, pneumonia, stroke and heart attack. The destruction of houses and lack of access to fuel or electricity due to damaged infrastructure could become a matter of life or death if people are unable to heat their homes. According to the government of Ukraine, over 800,000 houses have been damaged or destroyed in the country since the start of the war, and thousands of people are now living either in collective centers or damaged buildings without the protection they need against the harsh cold season. The coming brutal winter could prove particularly dangerous for vulnerable people, including the elderly, patients with chronic conditions, and maternal and neonatal services, especially given the current reality of low COVID-19 and other vaccines coverage. Indeed, we have seen COVID cases rise sharply in recent weeks, as they have elsewhere in the WHO European region. We must prepare for an increased burden of respiratory diseases this autumn and winter, as seasonal influenza co-circulates with SARS-CoV-2. Wintertime challenges and the latest escalation in fighting could add to significant internal displacement, with an anticipated 2 to 3 million people on the move within Ukraine itself, as well as another exodus of refugees to surrounding countries. Consequently, there will be an even greater strain on health services both in Ukraine and refugee-receiving countries. Mental health issues will also likely be exacerbated. Earlier this week, on World Mental Health Day, we noted that almost 10 million people at the present time are potentially at risk of mental disorders, such as acute stress, anxiety, depression, substance use, and post-traumatic stress disorder. This estimate was made before this week's escalation of hostilities. And the fourth priority I'd like to emphasize is the crucial continuation, despite the raging war, of healthcare reform in Ukraine. Before the war, the country had embarked on an ambitious healthcare reform process that had already begun showing strong results. However, recent economic analyses from the World Bank suggest the war could push 60% of the population below the poverty line, and UNDP estimates put that figure as possibly even higher, making it more and more challenging for people to afford essential medical services. An urgent roadmap is needed to expand universal health coverage in the months and years ahead. I would like to acknowledge here donor governments who make our work possible. WHO's humanitarian ask so far has averaged to about $10 million per month for our response in Ukraine. We need donor support to remain steady, if not increased, to enable in turn our support to Ukrainian health partners in the long term and for the health needs of refugees in surrounding countries. We can expand on these and other issues when we take your questions. But let me conclude by reiterating the message I conveyed at the very beginning. WHO is in Ukraine for the long haul. The country and its people can count on our partnership and support today and always. Thank you very much.
Thank you so much, Dr. Kluge. So now we'll go to the Q&A part of the press briefing. And we've got a question from Politico, and that is, to what extent are the COVID and flu shots reaching those in the front lines in the country? What work is underway to immunize both fighters and civilians? And also, is there a strong chance that we could see a huge spike in deaths from these infectious diseases? So for that, why don't I go to Dr. Jarno Habecht first, and then perhaps Dr. Katie Smallwood would also like to add something. Jarno.
Welcome from Kiev. And on the vaccines available for civilians, what WHO has been doing together with COVAX is that in the last 2 months, more than 500,000 COVID vaccines have been delivered to Ukraine. And in the next 1 month, we will see additional more than 1 million doses of COVID vaccine arriving to Ukraine, distributed across the country, as well more than 100,000 doses of pediatric doses of COVID vaccines will arrive. So what we see is that the COVID vaccines are available. And from our health survey, we also know that those who would like to have vaccine, majority of them also have access to vaccine and are using this opportunity. When it comes to the seasonal flu vaccines, these are to arrive to Ukraine as we speak and also be available. But our concern, of course, is demand to the vaccines, because we have not seen high demand to the seasonal influenza vaccine in Ukraine before. And just a final remark on the COVID situation in Ukraine now. We see gradual stabilization of the high numbers of COVID cases across the country. And we estimated as WHO high COVID peak more or less in the first 10 days of October, what we have seen, and we expect the cases to start to decrease after a few weeks. Thank you. Back to you, to Copenhagen.
Katie, over to you.
Thank you very much. And just to add to Jarno's comments specifically on the delivery of vaccines into the country and how we're planning on moving them forward, we're working very, very closely with our colleagues in Ukraine to ensure not only the vaccination, but also the broader flu and COVID-19 preparedness activities are really being scaled up across the country. Of course, what's most important is that we really focus on protecting those at most risk from those two diseases, wherever they are. And that becomes very, very important, especially when people are potentially in locations where there is active conflict, where their access to healthcare services may be disrupted in some way. And for that reason, the offer of vaccination is really critical there in making sure that people who are at particular risk of severe disease access the vaccine and therefore would not need to access those further services that they might need to should they had not been vaccinated. We're also working with the country in looking at our flu and COVID-19 surveillance systems. So we're conducting, even in the context of the conflict, field monitoring visits to sentinel sites, training of physicians and epidemiologists across 35 sentinel sites in the country. We're also working with them in scaling up their testing, both for influenza and for COVID-19. And we've seen some really positive signs of the recovery of the testing, laboratory testing in Ukraine for COVID-19 over the month of September. And this is something that we're going to be working very closely with the country to expand as Dr. Habis said, preparing for a future wave of COVID-19 and potentially influenza later on in the autumn-winter season. Thank you very much.
Thank you so much for that, Katie. So we've got a few questions from the audience online. Let me first turn to Dasha. If you would please unmute yourself and identify your full name and where you are from. Thank you.
Hi there. Thanks very much. My name's Dasha Afanasieva and I am a reporter at Bloomberg. Thanks very much for your comments so far. I just wanted to hone in a bit on this, the two questions of health facilities being targeted and also people not having access to heating. So could you please speak a bit more about the impact of the latest escalation and kind of what happens on the ground every time there's a bunch of bombings? Sort of how many, more people had no access to healthcare? Could you sort of give a bit more detail about the impact of late and what could happen in the future if this strategy is doubled down upon? And similarly with the heating question, you mentioned that Kiev says that 800,000 houses are damaged and that people are sort of living in groups. Could you speak a bit more about how many people are actually at threat of cold-related illnesses this winter as it gets cold, and people who don't have access to heating? Thank you.
Thank you so much for that. So for that, let's turn to Dr. Jano Habist. And I think there as well, we've got a health survey that can also be added on to the answer. Jano.
Thank you. And thank you, Tasha, also for the question. Let me say what we have seen and the cruise missiles and the drones coming to Ukraine and across the whole Ukraine on Monday onwards, that it's early days to have full assessment. What we know is the electricity has been impacted in more than 15 oblasts. We have discussed with authorities what implications it has to the hospitals. We know that around in 10 oblasts, there have been also blackouts, electricity blackouts in the hospitals. At the same time, number of generators are already available. We have other partners who have delivered hundreds of generators before to the primary care centers and hospitals. As well, WHO will deliver in the next 3 months additional 100 generators, but our focus is more in east and south in the areas of Kherson, Mykolaiv, as well in Donetsk, Luhansk, and Oblast in the east and south. But it's early days to have full assessment available, but we have been looking ourselves as well in the dialogue with the government to see what implications it has. Now, when I look from our own personal experience, all of us in the past 5 days have been without electricity. And in Kiev, in Lviv, in many of the cities where WHO teams are working, as well in Dnipro, there are power cuts which last from 1 to 12 hours. So we need to see what implications it has to people, at homes, as well what implication it has for the healthcare facilities. And this is ahead of us, as Hans was mentioning, forthcoming winter. It's extremely important in the coming 2 to 4 weeks to understand where the main gaps are and what can be done more. And on other aspect that Roy, you mentioned, WHO just finished also health survey, and that's an important aspect. We take a stock before the escalation that we saw from 10th of October onwards. What we see is that the health system is still resilient and provides access to the primary health care services as well the hospital services for chronic care for many. But as we all have heard, it is not equally available across all the country, especially in the occupied and the liberated areas. Restoring the services or ensuring access to services is difficult. Few of the examples, people have access to medicine, but we see that every fifth person has some barriers. And without electricity, with more disruption, that number could go up. But if we compare now across whole Ukraine, when 20% don't have access to medicines in the occupied territories or active hostilities, this is every third person. So there, people have much more difficult conditions. We have many elderly who are in those areas and they need chronic care. And this brings me to another aspect, is that our health survey shows that more than 50% of the visits to the facilities is really for the chronic care, to have access to care for hypertension, also diabetes care, etc., etc. So we need to ensure that while there are various support available, we start to ensure more and more chronic care to be covered as well. And also what we see is the main barrier that people have is now cost, because in the early days, when we compare to April, May, it was availability of services. Now services are available, especially in the central and western part of Ukraine, but the cost, because people might have decreased income, the inflation as well, the poverty levels are going up, as Hans mentioned. So we need to see how to ensure accessibility also and how to address those barriers that have emerged from September, and we assume that they will stay with us in 22-23. Back to you, Roy.
Thank you so much, Jano. And we have a question now from Carlo. Carlo, please, can you unmute yourself and identify your full name and where you're from? Thank you.
Yes, thank you for taking my question. I'm Carlo Martuscelli, also from Politico. I had another question about the cold. I'm going to put it very bluntly. Are we expecting any deaths from hypothermia in the winter related to the lack of infrastructure? And if so, can we quantify those? And secondly, what is the remedy here that the WHO could provide? I believe Dr. Havik mentioned earlier that generators are being sent to hospitals. Could we imagine smaller generators being sent to homes to help provide electric heating, something like that? Thank you.
Thank you so much. I think that's a two-part answer. Let's first turn to Dr. Kluge for that, and then we'll turn to Jano. Hans.
So, Carlo, the short answer is yes. I mean, this is indeed going to most likely be a matter of life and death for many people, because the basic principle is that there has to be at least one warm room in a house, in a home. But in several of the liberated territories, the time is too short even to do small repairs. And this, we anticipate, will lead to frostbite, to hypothermia, pneumonia, strokes, heart attacks. I will give then the floor to Dr. Jarno Habich, who can go a little bit more in detail of what has been done not only by WHO, but by the 150 partners active in health, and of course under the leadership of the Ministry of Health. But it includes, as you say, diesel generators, portable heating devices with fuel, also survival blankets. The key issue is that the needs are so huge. So even if you put all the efforts together from the partners, the needs are still uncovered. So it comes back to the basics, like heating infrastructure and energy maintenance. But with this, I'm giving over to Dr. Jarno Habicht to go in detail.
Thank you, Carlo. And I would highlight 3 points here. First, our focus has been mostly on the healthcare, ensuring healthcare to be available in the wintertime as well in the liberated areas. But while doing that and visiting many of the sites, we talk to people in the field, what they go through. And what Hans was mentioning, there are frostbites that we can expect. There are increase of chronic diseases, especially respiratory diseases and others. So our focus has been on the healthcare system, but at the same time, we are hearing many of the patients, a lot of the people with whom we talk, that the winter is something that we need to get all prepared. Second, what we estimate is also in the liberated areas, especially when we look to areas in Kharkiv, as well those now in Donbass, we assume that a lot of people might move when the winter comes inwards. So internally displaced people, the number of internally displaced people will increase. So we need to be ensuring that healthcare is available for them, but also on housing. And now I will come back to the broader UN system, which is led by Denise Brown now in Ukraine. And what we see is the UN has its winterization plan, where it focuses also how to ensure the housing, the collective centers and others to be available, that those who don't have the warmth in their homes, then they can find a shelter where to stay over the winter. And finally, it all comes to complement what the government is doing, because in addition, it is the Ukraine government also who is putting a lot of effort to ensure that we are ready for the winter. But a lot has changed since 10th of October, and everybody is doing a reassessment as well. These missiles are still coming. So we need to be ready also for the next waves of people moving, but also ensure that everybody has safety. Back to you.
I think Dr. Smallwood would like to add something.
Yeah, I just wanted to add a couple more points here, because exactly when Jarno was talking about what we're anticipating in terms of people moving as a result of increased violence, who are the people who are there, who are the people who are going to move, and who are the people who are going to stay? What we know from eastern Ukraine, we know this in Donbass since 2014, the people who stay are those who are particularly vulnerable to the cold. They're the people who are over 60. They're the people who don't want to move, that might not have, are not as mobile as younger people. These are also people who are going to be much more prone to the severe effects of respiratory viruses such as flu and COVID-19 over the winter. These people need access to health services. They need access, safe access to hospitals that are functional, that have electricity, that can run systems, that can run ventilators, and that are intact structurally and not subject to attacks.
Thanks so much, Katie. There is a question about the surrounding countries and what are we doing with the partners to prepare countries for a possible new, shall we say, refugee wave. And so for that, may I turn to Gerald, Dr. Rockenschab.
Well, thanks very much for that question. Indeed, very relevant, because we don't have displacement only within Ukraine. Unfortunately, we have people also crossing the border to neighboring countries, refugee hosting, refugee receiving countries. We have established a refugee support hub in Poland that is coordinating the support to refugee hosting countries. And we're working with the UN country teams there to generally strengthen the health system to meet the health needs of the refugees and displaced. Now, fortunately, the European Union has activated this temporary protection mechanism, which ensures that health services are available to those people displaced so that they can access health services in the refugee receiving countries. But there are also gaps, because also those systems tend to be overwhelmed. They're also coming out of the COVID emergency and have their gaps. particularly at the primary care level. So we're working collectively with the UN country teams on winterization plans, like in Ukraine, making sure that vaccines are available, that the surveillance system is enhanced and strengthened, that we have medications and supplies in place, and training of health workers to specifically pay attention to the health needs of the Ukrainians that are displaced. So these activities are in place. We just published the winterization plan for Moldova, where we just been with our regional director. And these preparatory efforts are ongoing in all the refugee receiving and hosting countries. Back to you, Roy. Thanks.
Thank you so much for that, Gerald. So there is a follow-up question to what we said earlier, which is about up to 60% of the country being pushed below the poverty line and the access to healthcare as a consequence. So what can be done about it? What is being done about that? What is the conversation to actually help strengthen the access to the health services? So for that, let me go to Jarno, and then others might want to also chime in. Thank you.
Thank you. And as mentioned before, what is important that first Ukraine health services are available, especially when we look to the center and west, as well in many areas now which are liberated in the 4 oblasts, in Kiev Oblast, Zhytomyr, as well in Sumy and Chernihiv. And now we see south of Kharkiv as well. So what is important is that system to function, and there the overall health financing and the level of health financing needs to be sustained. And there we see support to government of Ukraine, particularly from the US, the World Bank, the United Kingdom, who ensure that actually there is a support and the budget support available for Ukraine. So that's one, because that allows to sustain the health services as they were. The second, what needs to happen is the humanitarian response that then complements that support. And what very practically we have been doing as a WHO in the liberated areas around Kiev Oblast, like Bucha, Irpin, Makariv, where, for example, extended primary healthcare teams who work there over the weekends, with whom I have been also in the field, who then had medicines available to provide those medicines for those who don't have access to them. So this is the humanitarian response that needs to complement what is available at the national level. The same way we have handed over number of products, including insulin, to the government system that also can be distributed through the hospitals and primary care centers. And that is a possibility, ensuring the access to care. But we need to do more, and everybody to do more, because we see the chronic conditions to be one which is increasing, as well as Katie was mentioning, people who are now in the liberated areas, those who are in at their homes, are those more elderly, and that chronic care needs to be taken care of. So first of all, to keep supporting Ukraine health system with the budget support. The second, complement with the humanitarian support. And the third one, we need really to address the vulnerabilities and to whom we need to support, including those who are elderly. Back to you, Roy.
Thank you so much, Jarno. We have a question that's just come in on mental health. And it is basically that we speak a lot about the infrastructure that has been damaged, but what about the mental health conditions that you spoke about? What is the likely long-term impact, and what can the country do to plan for the long haul when it comes to this crisis? And for that, may I turn once again to Jarno, but then after that, perhaps to you, Hans, to speak about the mental health coalition that has been supporting this as well. Jarno.
Thank you. And what WHO has supporting is to have the National Mental Health and Psychosocial Support Program that is led by First Lady Zelenska and Minister of Health to be in place. And that unites many of the partners who can do work on mental health. And there are more than 300 partners, national NGOs, international NGOs, service providers, who are now addressing those mental health needs in Ukraine. And Hans will talk more what we do in the whole region. What we have been doing in the past weeks and months is three main aspects, three areas to mention. One is to the tools for the stress management for the general population, as well the cascade trainings that we have trainers available across the whole country. The second is mental health training and psychosocial support to the first responders, particularly in the primary health care and their trainings in the WHO tools like MHCAP. And the third is to work with the community mental health teams. We have 87 community mental health teams across the whole Ukraine. And from those, 27 are supported in particularly by WHO. So these are the three very concrete things which are done to support the national mental health and psychosocial support program, which is put in place in Ukraine with many of the partners. But what we see, and Hans mentioned 10 million people, is this 10 million people comes from the global estimate, what we have seen in average war situations. And that means mild status until the very difficult cases. And we think that more than 2 million people suffer from more mental health conditions and severe mental health conditions. So we need to address that. And Roy and colleagues who are asking how long this impact will be, I think this impact personally will be for this century. It will be generations who are remembering how they fled the country in the late days of February, or how their families have been without electricity. Now many are thinking how to survive the winter. So this 10 million is the current estimate. But as the studies goes on, I assume that number to be much higher in Ukraine, but then also in the neighboring countries. And back to you, Roy and Hans.
Hans, over to you.
Thank you. Thank you, Jarno. Great reply, sobering as well. It's a pretty complicated picture. Actually, the mental health was identified as a so-called flagship priority for the WHO European Programme of Work before the war and before the COVID-19. There is the war in Ukraine with tremendous impact on mental health of the people in Ukraine, but you could almost say on all countries, because all countries are impacted by the war in Ukraine in some way or another, number one. Number two, we see more and more effects now on mental health from the COVID-19 and the lockdowns and the long COVID. The latest studies are showing us that more or less 17 million people in the region may be impacted by long COVID, which also has a clear mental component. And then many people are distressed with what's happening now, the cost of living and the climate crisis. So there is clearly not good health without mental health. For this, the WHO regional office established the Pan-European Mental Health Coalition, involving almost every representation in the society. We had recently World Mental Health Day. The key I take away from the research being done is that everyone is vulnerable. So it's not the old speech that people with predisposed vulnerabilities are more exposed. The brain works very strange. Every one of us is a potential person which is struggling with mental health. And the key there is the society to speak about this. Actually, at this very moment, we have our people in Rome on the Global Mental Health Summit, including on the mental health in workforce. And that's a big concern, that our workforce is exhausted from the COVID-19, but now has also burnout and mental health issues. And we're taking this forward with different initiatives. Thank you.
Thank you so much for that, Dr. Kluge. So I don't see any more questions from the media, but before we wrap up, I wonder, Dr. Kluge, if you would like to have a concluding statement, and then perhaps Jarno as well, so that we can round this up. Over to you, Dr. Kluge.
I would say that what we see now is that we're living in a kind of a perma-crisis, a kind of a permanent crisis. So the new normal, we're calling dual track. Countries have to be ready for emergencies and to manage them, but at the same time, no interruption in routine disease prevention and control. And the main theme today was on the public health impact of the war in Ukraine and the clear appeal to governments, to the people in Europe, globally, is not to be fatigued. Many people are struggling with their energy bills. It's very clear. It's going to be a tough winter, but I think this is the opportunity to show the resilience of the European continent to stand in solidarity, really, for a better health and well-being and ultimate health to be there for peace. Thank you.
Thank you so much. Jarno, one final statement from you before we can close this briefing. Thank you.
Thank you. And most of it important is it's good to share from Kiev and across all the cities where WHO team is available across Ukraine. And we continue to support and deliver in the field as we have been doing since 24th of February. And actually many years before, as Hans was mentioning before, we are here to support. We have done it years before and we continue to do that. The three priorities for us currently in the field is the humanitarian response that mainly addresses the vulnerabilities of the health system in east and south of Ukraine. But of course, we are supporting the whole system also with a humanitarian support and laboratories, public health systems across the whole country. First priority, humanitarian support. The second is we will see service disruptions in the months to come over the winter, but also without the winter, because chronic care needs to be there. We need to address other conditions and diseases. We can look to HIV, TB, as well. We need to ensure that the immunization services are available there for routine as well for the COVID, seasonal influenza as well. So we will see service interruptions more and more, what comes up also from our health survey, and we need to address those. And the third priority for us, as Ukraine is moving on with the recovery and reconstruction plan, is to support long-term system strengthening, where WHO has issued the principal paper together with Hans Kluge and then the whole team. As well, what I see encouraging, we have visited one of the primary care centers also with Dr. Tedros in May, and that center was totally destroyed after attack. What I see now is this center is gradually built up already. So we cannot wait with the reconstruction and recovery for years. The war goes on, but recovery also has started in Ukraine. So three priorities: humanitarian support, addressing service disruption, and looking forward to the recovery. Thank you.
Thank you so much, Jarno. Thank you, Dr. Kluge, Dr. Smallwood, Dr. Rockenschaub and Dr. Benesch. With that, we end the briefing, and we will see you soon again. Take care, stay well, stay safe. Thank you.